Today, we're going to open up the actual playbook paramedics use when someone is in serious pain. Let's break down exactly what it says.
So, let's set the scene. Imagine the flashing lights, the urgent questions, and you are in absolute agony. What happens now? Do paramedics just wing it based on experience?
No way! It's not guesswork at all. A paramedic's response to pain is actually guided by this incredibly detailed protocol, and that's exactly what we're using as our source today. It's a whole system, designed to be safe, effective, and consistent every single time.
All right, so where does this whole system even begin? Well, it all kicks off with a really quick but super thorough on-scene assessment.
Yeah, before they even think about medication, paramedics are running through this mental checklist. They're asking about your medical history, what meds you take at home. They're using a standardized scale to figure out your pain level and what makes it worse. And this is key. They're trying to figure out if this is brand new, acute pain, or something you've been dealing with for a while. It's all about getting that complete picture first.
Okay, so once they've got that initial picture, what's next? They move on to the basics, fundamental supportive care. These are the steps they take to get the patient stable before they even consider the heavy-duty medications. And this checklist, it's their top priority, right out of the gate. They're making sure you're getting enough oxygen, they're getting access for potential meds or fluids. That's usually an IV in your vein, but if they can't get a vein, they can use an IO line, which goes right into the bone. Wow. They'll also hook you up to a heart monitor if they have any concerns. And get this, they even consider things that don't involve drugs, like just changing your position or splinting an injury to make you more comfortable.
All right, now we're getting to the first level of medication. And what's interesting is, if it's the right call for the situation, the protocol actually allows for common pain relievers. Stuff you might have at home, like acetaminophen or ibuprofen. It shows it's not always about reaching for the strongest thing right away.
And this right here, this is a perfect example of the built-in safety checks. The guideline gets super specific about when not to give a drug that seems as simple as ibuprofen. Are you on blood thinners? Is there a chance you might need surgery? They have to answer these questions first. It just goes to show you, patient safety is always, always number one.
Okay, let's level up. For the really severe pain, paramedics have a whole toolkit of powerful, fast-acting medications they can turn to.
So check this out. It lays out the main options so clearly. You've got fentanyl and morphine, two really potent opioids, and then you have ketamine, which works in a totally different way. And look at all the ways they can give these meds. You see IN? That's intranasal, up the nose. IV is intravenous, in the vein. IM is intramuscular, into the muscle. And IO, we talked about that one, into the bone. Ketamine is often given SIVP. That stands for slow intravenous push. All this flexibility gives paramedics a ton of options depending on what's going on. But honestly, the most important stuff is right there in that third column, the safety notes.
See a pattern here? It's staring us right in the face. Both fentanyl and morphine come with the exact same critical warning: hold for hypotension. So what does that mean? It means if the patient's blood pressure is too low, which is often a huge red flag for shock or a major injury, these powerful drugs are a no-go. They're completely off the table. Safety just trumps everything else. Period.
And you know what? This focus on safety doesn't just stop once the medication is given. Nope. In fact, you could argue that's when the real work, the most intense monitoring, actually begins.
So for instance, the guideline is smart enough to plan for potential side effects. Take ketamine. There's this thing called an emergence reaction that can happen as the drug wears off. The patient might get agitated or even have hallucinations. That can be pretty scary and distressing for them.
But here's the brilliant part. The protocol doesn't just say, hey, this bad thing might happen. It gives them the solution. It lays out a crystal clear two-step plan. First, recognize the signs, and second, give a specific medication, midazolam, also known as Versed, to calm the patient down. And notice that little caveat, again, only if their blood pressure is stable. It's like there's a plan for the plan.
Okay, now I want you to just look at this number. Just 5. Because this single number represents one of the most critical rules in this entire playbook.
5 minutes. That's it. That's the mandated time between check-ins. Every 5 minutes after giving one of those advanced pain meds, the paramedic is right back there checking the patient's pain level and retaking their vital signs, heart rate, blood pressure, breathing, the whole shebang. It's this constant, relentless loop of monitoring and responding. And really, that 5-minute rule perfectly brings us to our final big idea here. This whole thing isn't a straight line. It's a continuous cycle of patient care. So what's the big takeaway?
I think it's that a pain management protocol is so much more than just a list of drugs. It's a living, breathing system of assessment, intervention, and constant reassessment. The whole thing is designed to make sure every single patient gets safe, thoughtful care, even when everything around them is complete chaos.
So how can a simple document do all that? How could it make sure every single patient gets the best possible care? Well, the next time you see an ambulance, maybe think about this. It's not just about speed and a paramedic's personal experience. It's about this incredibly well-designed system, this playbook that's working in the background. It's like the silent partner on every single call, turning pure chaos into a calm, continuous cycle of care.